Hey all, welcome to Share Trek. And if you are Canadian, a belated Happy Canada Day to you. I'm recording this on 1st of July. I just had been in a Canada Day barbecue with my friends and it was a wonderful experience. We had a great time. So by the time you see this video, it will be 2nd of July. So belated Happy Canada Day. And to our American audiences, I hope your July 4th celebrations have already begun. Enjoy your long weekend. And today in this video, we dwell into the mechanisms behind type 2 diabetes and provide practical advice for managing the condition, learn about the causes, symptoms, and the importance of lifestyle changes, discover how to recognize signs of high or low blood sugar, develop a healthy eating plan, and stay active. Join us as we explore the key factors and strategies for effectively managing type 2 diabetes and promoting overall well-being. Welcome back, friends. In today's society, the prevalence of type 2 diabetes is on the rise, affecting millions of Americans. And also, it's a big disease that happens to Asian Americans like Indians. And it's crucial for individuals, both young and old, to understand how this condition develops and the importance of adopting a healthy lifestyle. This essay aims to shed light on the mechanisms behind the type 2 diabetes and provide practical advice for managing the condition. If you look at how type 2 diabetes happens, basically type 2 diabetes is a metabolic disorder characterized by high blood sugar levels. Unlike type 1 diabetes, which is typically diagnosed in childhood and requires insulin therapy, type 2 diabetes often develops in adulthood and is strongly linked to lifestyle factors. The primary factors contributing to development of type 2 diabetes are insulin resistance and the inability of the pancreas to produce enough insulin to stimulate the cells to metabolize glucose. Insulin's role and insulin resistance are the key factors that we have to focus on if we want to understand type 2 diabetes. Insulin is a hormone produced by the pancreas, and it acts as a key that allows blood sugar or glucose to enter our cells and provide energy. In individuals with type 2 diabetes, the cells become resistant to insulin, resulting in reduced glucose uptake. Consequently, the pancreas compensates by producing more insulin to overcome this resistance. However, over time, the pancreas may struggle to keep up with the demand, leading to elevated blood sugar levels, because as time goes by, the increasing levels of secretions from the pancreas is unable to sustain the level of insulin required to metabolize the sugar, because the cells are progressively becoming more and more desensitized to insulin. And in this, the role of lifestyle is very, very important. Lifestyle choices play a significant role in the development and management of type 2 diabetes. Unhealthy eating habits, sedentary lifestyle, and obesity are key factors contributing to insulin resistance and the development of the type 2 diabetes. A diet high in processed foods, saturated fats, and sugary beverages can contribute to weight gain and metabolic dysfunction. Regular physical activity, on the other hand, helps to improve insulin sensitivity and maintain a healthy weight. Recognizing the signs and risk factors is also another important aspect for many people like myself who are conscious that we have a predisposition to type 2 diabetes, because some elders in our family had type 2 diabetes in a very young age. So it's very important to understand what are the signs and risk factors that we have to look for. Being aware of the signs and risk factors associated with type 2 diabetes is essential for early detection and intervention. Symptoms such as increased thirst, frequent urination, unexplained weight loss, fatigue, and blurred vision may indicate the presence of the condition. Risk factors include being overweight, having a family history of diabetes, being physically inactive, and having certain ethnic backgrounds such as African American, Hispanic, or Asian. Now let us switch to look at how to manage type 2 diabetes. Managing type 2 diabetes requires a multifaceted approach that involves making lifestyle modifications and closely monitoring blood sugar levels. The following actions can help individuals manage their blood condition. Let's look at the first one, developing a healthy eating and activity plan. You should focus on a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Engage in regular physical activities such as walking, cycling, or swimming. Test blood sugar and sugar levels and keep a record. Regular monitoring of blood sugar levels helps individuals understand how their bodies respond to different foods and activities, and therefore they can fine tune their eating habits and activities to optimize their outcome. You also need to recognize signs of high or low blood sugar by how you feel. Understanding the symptoms of both high and low blood sugar levels is crucial. Prompt actions such as adjusting diet or administering insulin if needed can prevent complications. Medication management is very important. Some individuals may require insulin therapy, which can be self administered using syringes, pens, or pumps. It's important to follow the prescribed dosage and administration instructions. And I remember seeing my dad self-administering insulin for quite a while, and then my mom started doing it for him, and he was under a lot of restricted diets. But it didn't seem to help because he couldn't control his diet. When he used to go out, he used to indulge in all his, he was a foodie, he used to indulge in all the things that he liked. That definitely did catch up with him. The other thing one can do in order to control and manage type 2 diabetes is to go for regular checkups. Regular visits to healthcare professionals are vital for monitoring overall health, assessing diabetes management, and catching any complications early on. And one of the things I would like to emphasize to all the viewers who are interested in this particular topic is that diabetes, I would call it as a silent killer, because when diabetes comes in, it doesn't create a big issue, because either you may be dizzy and you may fall, and then you understand that your blood sugar has gone low and you get some treatment, you eat some sugars and you're back up again and you're walking again and you assume that, okay, that's fine. But what it is doing is it's silently injuring various organs in your body, like your eyes, your heart, your liver. And many diabetics die of heart-related complication or organ failures and things like that. So this disease is very dangerous and it should be taken seriously. And one has to treat type 2 diabetes with respect. If you suspect that there could be a predisposition for you to get type 2 diabetes, be on the alert, understand the symptoms, manage your lifestyle, manage your weight, and things should be fine. Type 2 diabetes is not a foregone conclusion. You can still dodge the bullet provided you maintain a good, healthy lifestyle. Type 2 diabetes is a complex condition influenced by various factors, including genetics and lifestyle choices. By understanding the mechanisms behind development of type 2 diabetes and adopting healthy lifestyle, healthy habits, individuals can effectively manage their condition and reduce the risk of complications. Regular monitoring and balanced diet, regular exercise, and medication management are key components in successful living with type 2 diabetes. In the next video, I'll be talking about the current thought on how insulin resistance develops, so that we can dwell down a little more deeper into type 2 diabetes to understand the whole mechanism of insulin resistance. And if you recollect, guys, in our channel earlier on, I had done 3 videos on diabetes, and that was focused on type 1 diabetes, where we talked about the mechanism of type 1 diabetes and how islet cells are destroyed. And then we talked about the genetic therapies that are available, which help type 1 diabetes patients to stay free of having regular insulin. So we spoke about CRISPR Therapeutics, VCTX, I think, we spoke about CRISPR Therapeutics, VCTX, and also spoke about other potential therapies that are down in the pipeline. I do not recollect which they were right now. But right now we are going to talk about type 2 diabetes, which composes the biggest universe of patients. Like if 100% of the diabetic patient in the world were accumulated, I think 10% would be type 1 diabetes, 90 would probably turn out to be type 2 diabetes. So this video is important for those people. And I think going forward, I would like to have a regular feature on diabetes and all the therapies that are coming up for diabetes. So I'm planning to devote at least a day every week for diabetes related programming. So if you are interested in this, please subscribe, and you will be able to see more videos on diabetes, type 1 as well as type 2. And with that, I would like to bring this video to an end. And I hope you have a great weekend and happy long weekend to you all. Bye, and I'll catch up with you again.